Tummy tuck or abdominoplasty is probably the real workhorse of body contouring procedures. For those individuals not overly familiar with the procedure, it really involves the removal of the excessive skin after massive weight loss or pregnancy, of the low abdominal wall, giving us the ability to remove that skin and fat that is not really going to shrink up adequately or satisfactorily with liposuction alone. The additional advantage of tummy tuck is the ability for us to manage the underlying muscle compartment with the previous pregnancies, one or multiple, and the advent of having been a larger weight prior to one's newfound weight. The muscle compartment suffers just as much as the overlying skin compartment. So the real advantage to the tummy tuck is that powerful addition of being able to realign the abdominal wall muscles to improve that core strength, in addition to removing the extra outer skin and fatty elements that may not be amenable to liposuction alone. So a very powerful tool for body contouring, oftentimes done in conjunction with some liposuction so that there's some harmony with what we do in the front of the abdominal wall with what the hip and flank are doing. So please feel free to contact the office at 727-376-3999 to find out more. Neck rejuvenation and as a consequence of neck aging is a very common consultation performed in our office, and I think that it's important, at least from my standpoint, to impart to patients and prospective clients that I think it's extremely rare that the neck ages so far in advance of the remainder of the face that there are a tremendous number of candidates out there for neck lift alone. We commonly perform neck lift at least with some element of mini facelifting so that there is harmony between what's done in the neck and what's done and the general appearance of the lower portion of the face. The three principal elements of neck aging that we have to address when considering neck rejuvenation procedures are what the skin compartment is doing, what the underlying muscle compartment is doing, and what the fat compartment is doing. And in any individual, it may be one, two, or all three of those components that are contributing to the aging of the neck. Those things are addressed at the time of the consultation, photographs are reviewed, and we will help determine your candidacy for a neck lift either with or without some lower face lifting procedure for harmony with the neck procedure. So please feel free to contact us at 727-376-3999 to learn more about neck rejuvenation. Thigh lifting as a plastic surgical procedure has really seen quite a boom in recent years, mostly as a fallout of the number of patients that have been seeking out gastric bypass surgery, lap band surgery, and with the advent of excessive weight loss, we've seen a tremendous number of patients come in for consultation regarding management of the extra skin and fat of the thighs. The thigh lift primarily involves retightening of the thigh in essentially for us more than one plane. The scars for thigh procedures are really deposed in two different locations. We have those patients who are candidates for having the thigh incision located entirely in the groin crease for more of a vertical lift. And we have those that have more redundancy to the thigh and fat compartment that require a vertical extension down the inner aspect of the thigh. That allows us to get a little bit more power, a little bit more fat, and a little bit more contouring, especially of the lateral thigh. Liposuction is very commonly employed with thigh lift procedures in the postoperative period, roughly about 7 to 10 days of minimal activity prior to getting back into the workforce and carrying on with one's daily activities. So if you'd like to learn more about thigh lifting, please feel free to give us a call at 727-376-3999. Arm lift or brachioplasty is probably one of the most misunderstood of the body contouring procedures that we see consultations for fairly regularly in the office. Again, a fairly large increase in the number of arm lift procedures with the advent of patients seeking out gastric bypass and massive weight loss surgery. Arm lifting can be done in a variety of different surgical capacities. Liposuction commonly performed with arm lift surgery. Traditional arm lift surgery involves an incision primarily placed on the back of the upper arm, again, to remove the excessive soft tissue and fatty elements of the arm that may not be manageable by liposuction alone. There are some variations in the kinds of arm lifting that can be performed. There are some what we call short scar arm lifts, where we try and conceal most of the scar to the armpit area. There's those short arm lift procedures that have a slight extension down the back of the arm, and then there's those more traditional arm lift procedures for those individuals who have experienced tremendous weight loss that involve incisions from the armpit area down towards the back of the elbow crease. Our consultation is primarily designed to determine your candidacy for which procedure is going to give you the most optimal outcome. So please feel free to give us a call at 727-376-3999. Liposuction is a very commonly employed surgical procedure in the practice. Liposuction is one of the most effective tools that we have for body contouring, the other being tummy tuck for those people where the skin is in excess. But liposuction still provides us with the finesse to really be able to sculpt those areas that are problematic despite dietary management and exercise. We employ a variety of liposuction techniques in the office. We use traditional tumescent liposuction. We also use laser-assisted liposuction. The procedures can be done under, depending upon the extent of the areas that need to be managed, we can do it under general anesthetic. It can be done under some light sedation. It can even be done under straight local anesthesia, so those patients can be ambulatory and go home driving themselves to and from the facility. So please feel free to give us a call at 727-376-3999 to determine your candidacy.